Hello, my name is Emma Cutbush. I'm going to be doing my assessment today. Good morning, everyone. I'm speaking to you today as a registered nurse working on our general medical ward. This in-service aims to improve the way that we deliver care to Aboriginal and Torres Strait Islander patients by focusing culturally responsive practice. So it is well established that Aboriginal Torres Strait peoples experience significantly poorer health outcomes compared to non-Indigenous patient Australians. Life expectancy is approximately 8 years lower, and the burden of chronic disease is 3.2 times higher. Cardiovascular disease, type 2 diabetes, kidney disease, and mental health conditions disproportionately affect Aboriginal people due to a complex interplay of historical, social, and systemic factors. Contributing factors include limited access to healthcare, socioeconomic disadvantage, intergenerational trauma, and systemic racism within healthcare institutions. These disparities are not only clinical, but they are deeply social, emotional, and cultural. So the National Aboriginal Community Controlled Health Organisation, also known as NACCHO, reminds us that health for Aboriginal people is about the well-being of the whole community, not just individuals. The issue I'm focusing on today is culturally responsive practice. Culturally responsive care involves recognizing, respecting, and incorporating the cultural identities, values, and lived experiences of Aboriginal and Torres Strait Islander peoples into their planning and delivery of care. So, unfortunately, it is often absent in hospital settings. Aboriginal patients commonly report feeling judged, misunderstood, or ignored in clinical environments. This can stem from assumptions about their behaviour, language use, family involvement, or health benefits. For example, the presence of extended family being at the bedside, it is a cultural norm. It is sometimes viewed as disruptive rather than being understood as an essential to healing and decision making for the patient. Moreover, the hospital system is structured around Western biochemical models, often excluding traditional healing practices and Indigenous ways of knowing. This lack of cultural intergeneration can lead to patients disengaging from care, delaying treatment, or avoiding hospitals altogether. Language barriers, culturally inappropriate communication styles, and lack of trust in clinicians can further exacerbate this disengagement. It becomes a significant barrier to achieving equitable health outcomes. As the reference argues, cultural safety is not about understanding difference, but it is about transforming the healthcare system so that Indigenous peoples feel respected, safe, and empowered. Cultural safety. A culturally unsafe environment also contributes to diagnostic overshadowing, where physical symptoms are dismissed as behavioral or psychological issues can due to stereotypes. This leads to poorer clinical decision making, delayed interventions, and ultimately worse outcomes for the patient. Culturally responsive care is therefore essential to mitigate these risks and build therapeutic, trust-based relationships with Aboriginal Torres Strait Islander patients. So, diagnostic overshadowing as nurses, we play a critical role in addressing the issue. We are often often the primary point of contact for patients and their families. The ability to create a culturally safe environment can shape and entire patient experience. So the role of nurses. So first we must commit to self-reflection. This means examining our own biases, privileges, and assumptions. Cul Cultural competence is not a static checklist, but continuous processing of learning and unlearning. We must be willing to listen actively to Aboriginal patients and acknowledging the historical and ongoing impacts of colonisation, including deep dispossession in institutional racism. Perfect. So, second, we must act as advocates within the hospital system. This includes challenging discriminatory practices in ensuring the inclusion of Aboriginal liaison officers, um, officers where um, in care planning and supporting patients in making culturally informed decisions about their treatment. Nurses also have a responsibility to support colleagues in developing their cultural understanding, fostering a workplace culture that values diversity and inclusion. So, importantly, we must shift from a deficit-based model, which focuses on problems, to strengths-based model that recognizes the resilience, wisdom, and community connections of Aboriginal peoples. This approach aligns with the Closing the Gap framework and helps build trust between healthcare providers and Aboriginal communities. So furthermore, as frontline professionals, nurses are well placed to build long-term rapport with patients and facilitate the co-design of care. This includes asking respectful questions involving families and understanding cultural obligations such as the sorry business or significance of country. These actions may seem small, but they are deeply meaningful for patients and families navigating a complex and often aligning health system. So, to implement culturally responsive practice in our ward, I would recommend doing these three strategies. So, we have mandatory To implement culturally responsive practice in our ward, I would recommend the following three strategies. Mandatory cultural safe training. As I mentioned, all staff should undertake evidence-based cultural safety training developed within Aboriginal health professionals and elders. This training should go beyond awareness and include practical skills in communication, engagement, and reflection. Research shows that cultural safety training improves confidence and attitudes among healthcare workers and leads to better patient experiences. It should also be ongoing embedded in our annual professional development plans rather than a one day off event. So number two, we have strengthen a role of our Aboriginal liaison officer roles. Our hospital must ensure that Aboriginal liaison officers are integrated early in a patient journey, not just at discharge. Nurses should be encouraged to consult with ALOS during admission and care planning. This promotes culturally appropriate communication and helps ensure patients feel seen and supported. Having visible and engaged ALOs also demonstrates institutional respect for Aboriginal culture. They can provide insight into family structures, language, preferences, and support traditional practices such as welcome to country and spiritual healing. Um, Amazing. So we also have culturally appropriate environment and signage. Um, so simple challenges to Simple challenges to our physical environment can make significant difference. This includes displaying Aboriginal artworks, flags, acknowledgement of countries in staff areas and public spaces, offering patients to access traditional healing practices, bush medicine if appropriate, or quiet spaces for ceremony can also foster cultural connection. These environmental cues that signal our ward is a safe place and not just clinically but culturally. Hospitals should also ensure that multilingual signage, patient information, in conclusion, culturally responsive practice is essential to improving health outcomes for Aboriginal and Torres Strait Islander peoples. It requires us to be more than clinically competent. We must be culturally accountable by recognizing the cultural context of health, challenging institutional bias, and taking practical steps towards inclusivity. We can create a healthcare environment that truly supports healing. As nurses, we are not just caregivers, we are advocates, educators, and leaders. Let's ensure that our care reflects the values of equity, respect, and cultural humility every day. We have the ability to make Aboriginal Torres Strait Islander peoples feel heard, respected, and supported. That is foundational of culturally safe care. Thank you for listening, and I encourage you to reflect on what actions you can take today to contribute more culturally responsive health service.